Afternoon, everyone. Thanks so much to Ross and colleagues for inviting me to this conference. I come from a region where heroin is the main focus, and most recently amphetamine-type substances. But today I'm going to be basically talking about what policies also affect cannabis and how Asia is progressing. So I have the very difficult task of condensing Asia into 30 minutes. And I might miss something, so I'll be really happy if you just ask all your questions later on. I'm going to set a little context by talking about Portugal and a little bit of Australia. I'm not going to cover too much because Steve's covered the diversion part already. I'm not going to talk about Uruguay or the United States for two reasons. The first is that Steve Rolls is the best person to talk about that. And also because Asian politicians do not look at those regions. Those are not really relevant to them. They don't, if you suggest it to them during a lobbying meeting, they just say, you know, why is this relevant? We won't talk about it. So they look at Australia, they look at Europe, and they look at the rest of the region. So the first thing is Portugal. Now last 2 years, I accompanied a bunch of politicians and Malaysian police to Portugal to have a look at their decriminalization system. So they decriminalized possession of drugs for 10 days. I think it's important to say that because they always say all drugs are decriminalized, full stop, and that's not true. So you can possess 25 grams of cannabis, or was it 5 grams or 2 grams of heroin for 10 days. And where that happens, you're taken to the police station, it's weighed, and what happens is you're diverted to a dissuasion panel. So a dissuasion panel is a panel that exists in each state in Lisbon. I don't think they call them states, but in that particular area. And it consists of one psychologist, one social worker, and one lawyer who assess what that person needs. So, and that's only for 25 grams of cannabis for 10 days. If it's above that level, they go into the court system, as usual. And these are statistics that were given to me by the Portuguese drug czar. And, you know, you can see a reduction of arrests at the end there, and they adopted this policy in 2011, but 2001. And basically what's happening is the police are basically just refocusing on people who are carrying more drugs. Nevertheless, you know, what you can see from Portugal is that they have a range of services for all sorts of drugs. They have, you know, the treatment centers are just amazing. They've got, you know, yoga, they've got methadone for heroin, they've got psychologists in there, they've got art classes, they've got just really, you know, comprehensive services of all types for persons dependent on drugs. Now, this is one of the things that Asian governments really like. The next thing I want to go into is police cautioning for cannabis and drug diversion. I'm not going to say too much about that, but those statistics at the bottom are from Victoria Police, and I was just there last month to have meetings with them. You know, this really works with our police. Malaysian police. Malaysian police really like hearing about drug diversion and they think it's great. But there might be a reason behind that, which I'll talk about in a bit. Now, drug policy in Asia, we come from a very, very punitive area where drug use is criminalized, and we still have the death penalty for drugs in Thailand, Malaysia, Indonesia, and Vietnam. Laos does not practice it, and Cambodia does not practice it. So in Malaysia, for 200 grams of cannabis, you can get the death penalty. Now, Malaysia is not executing anyone. It hasn't executed anyone for 2 years, but it still sentences persons to death for cannabis, and it still jails people for cannabis. Vietnam executes actively, but because statistics are a state secret, we don't know how many people are being executed. Indonesia has been executing actively recently, and they make it public. 2 weeks ago, I think it was the 12th, was it the 12th of November, that somebody, a Pakistani person was executed for trafficking 1 kilogram of drugs. So, and in Malaysia, the Dangerous Drugs Act applies jail and caning for persons who possess drugs. So caning can go up to 12 strokes of the cane, depending on how much drugs you possess. And it's crazy. I just got statistics the other day on how many people have been caned up to April. And up to April 2013, so January to April 2013, 29,000 people were caned for drugs. So that's pretty crazy. So in Asia, what we're doing is we're taking baby steps. We're taking examples from these countries and slowly moving towards better drug policy. A little bit more about Malaysia, because that's where I work and that's where I'm most experienced, is that Malaysia really wants to move towards voluntary treatment. So what Malaysia has done is for so many years it had compulsory rehabilitation centers. And in 2011, they decided, okay, it's not working, and we're going to convert them to voluntary centers called cure and care centers. Now, if you go to international conferences, you're going to hear our anti-drugs agency, who own these cure and care centers, say, how great they are and how we don't have compulsory rehab anymore, and that's not true. We do have compulsory rehabilitation, and at the International Congress on AIDS in Asia and the Pacific last week in Bangkok, I heard them say they're definitely keeping the compulsory rehabilitation centers, even though we have more voluntary centers now, because if people don't want to go to voluntary centers, we will make them go to compulsory centers, which is ridiculous, because that means that the entire system is coercive. So I think there's a problem with ideology there. But that's basically what's happening in Malaysia, and we have lots of voluntary treatment centers, but there's the threat of compulsory rehabilitation that still exists. But it's not all bad news. In Cambodia, for example, there is de facto sort of decriminalization, because that poster's in Khmer. I can't read Khmer, but it's a poster that you can find at the airport, at all major ports in Cambodia, and it's a poster that talks about what you could be arrested for, so the most dangerous drugs, and there's no cannabis on that poster. And that's because in Cambodia, cannabis is used traditionally, and you can buy it at some coffee shops, and it's sort of de facto decrim or de facto legalization. However, they do have penalties for trafficking, what they consider trafficking, but it's really just, that there it is. It's 10 to 25 kilograms, and you get 5 to 10 years. And so that still exists. However, when I talk to my Cambodian colleagues, they're just like, FIFA, it's not a big deal. We're not going to bring it up. So what I sense from them is that there's no push to actually get it in the law that it's legal, because they just don't see it as a big deal. Police are not arresting people for joints. So, we are not going to be able to look at Cambodia as a positive example for other countries in Asia, because they're just not interested in pushing it, because they already have decrim. Now, Indonesia, this hasn't even come out yet, so you're probably one of the first few people that are getting this. This regulation is currently being discussed with the East Java police, provincial police, and it's actually already been signed, so it's going to come out very, very soon. They are establishing an assessment panel. They didn't want to call it dissuasion panel because they didn't want to say that they're getting it from Portugal. But it's basically the same thing as what Portugal has. So the police has power to divert people to this panel, and this panel can divert them to whatever services are necessary. Now, there's a problem with the composition of this panel. It's not like Portugal, where they have psychologists and social workers and lawyers on it. the composition of this panel is one doctor, and the other one is the person, which is the National Anti-Drugs Agency. It's called BNN. So they're really nasty. I've met them. They really believe in punishing people. And one senior police officer, and one one professional that the individual appoints. So there's 4 people on this panel, and 2 already are very, punishment oriented. So I don't know how good this is going to be, but it's better than straight going into the court system. So OSF is actually behind this, and my colleague Risa from Indonesia is the one that has really put his work into this. And we're really hopeful that this works in East Java, because then we could use it as a positive example in Malaysia. Now, the problem about this is that all of these countries are really corrupt. There's a huge degree of corruption in these countries with police. And I do a lot of qualitative research in Malaysia with police and drug users, and it's just unbelievable how drug users are used as ATMs all the time. They just go to drug users and say, look, I'm going to put you in the lockup center if you don't buy me 4 tires for me to go home for Christmas. That's what it's like. So, what is the worry is that corruption will increase after diversion is instituted. And, this is the main argument that people say, and maybe Steve has some comments about that. But, we really don't know. It's going to have to take a whole overhaul of the system to install diversion and not have all these systems, these problems come up. So these are the slides. You shouldn't ask me where I got them, but that is a presentation by the police in Indonesia at the conference last week. And I just wanted to show you this because on one of the slides, he says that the National Narcotics Board encourages drug law reform and supports decriminalization of drug use and abolition of imprisonment of drug users, which I think is fantastic. I did not expect that Indonesia would say this at a conference. It was unbelievable, and I don't know what's up with them. They never behave like this, and I was just shocked. But if this is the start of drug law reform in Asia, then fantastic. Okay. Now, what's happening next week on Tuesday is that there's a drug law reform parliamentary roundtable that our law minister will be hosting. And our law minister's name is Nancy Shukri. And this year we had a conference on AIDS in Malaysia, and she said that drugs should be decriminalized. She just said it in the press, and that doesn't happen in Malaysia or countries across Asia. No one says that. And the fact that she's the law minister, that was amazing. So I thought that, the party whip would come and, shut her up and she'd never say it again. But, she's been really great. And she said, look, what we're going to do is, have this parliamentary roundtable, which I mentioned to her before. I'd really like to have one. And she said, I'll host it if you like. And I said, great. And she said, I can even moderate it if you like. So she was really open, and she wants to see decriminalization happen in Malaysia, which is fantastic. So that's happening next week. And to who's interested, I'll be happy to update you in that regard. And one of the provisions, I was only allowed to modify 4 provisions in the Dangerous Drugs Act. They just told me, FIFA, you have to take 4 provisions and draft alternatives, and that's all we talk about, even though the entire act is defective. So one of them is Section 15(1)(a) of the Dangerous Drugs Act, which is consumption. And people who consume drugs, including cannabis, and most of the cannabis offences come under 15(1)(a) and not under any of the other sections. So this is one of the sections that we're looking at. And we are looking at reforming it and changing it to divert it to health services or assessments, because in Victoria they have mandated assessments, and we thought we could have that. And also that section on 20 to 50 grams of cannabis, you get 2 to 5 years in prison and caning. And the 3 to 9 strokes of the cane is just barbaric. You know, the second stroke itself results in the breaking of the skin on the buttocks. So it's really, really barbaric. And we're getting rid of that, hopefully, if they vote in favor of my proposals. And that's basically it there. Now, the discussion on cannabis in Asia has been difficult to bring up because everyone's so focused on heroin. We're so close to the golden triangle, and heroin's a big problem. And also we have a huge amount of amphetamine-type substances coming in. But through policy debate around these things, cannabis gets pulled in, and the laws apply to all of these drugs. So that's what we do. And you know, you can see that there's sort of an ideology change as well in Malaysia, because the police keep saying, no, we don't arrest anyone for cannabis. We just let them go. We don't jail them. So I think there's a realization among the police that you know, this is just unacceptable. So yeah, it's a journey. It's still a long way, and I'm so happy to hear so many positive examples from you guys here in New Zealand, and I'm happy to take any questions. Thank you.